Rule 4 covers two types of devices: devices intended for self-testing and devices intended for near-patient testing. Let's look at this rule. Devices for self-testing are all classified as Class C with the following exceptions. The device is used for the detection of pregnancy, for fertility testing, for determining cholesterol level, and for the detection of glucose, erythrocyte, leukocytes, and bacteria in urine. If the device falls in this list, which is included in the regulation and in the guidance, the device will be Class B. For the second exception, the guidance reminds us of implementing Rule 1.9 of Annex VIII. This rule says that if several classification rules apply to the same device, the rule resulting in the higher classification shall apply. This means a device for self-testing used to detect the presence of a transmissible agent that causes a life-threatening disease with a high or suspected high risk of propagation. For example, devices for self-testing for HIV would be Class D. Devices intended for near-patient testing, on the other hand, have to be classified based on their intended purpose or in their own right, as the regulation says. This means that the classification of near-patient testing devices is in line with the classification of all other devices for professional use. And all rules or classes are to be checked and are possible. For example, if a near-patient testing device is to be used to determine abiocompatibility prior to transfusion, the device will be Class D. If the device is to be used to monitor the level of troponin I, the device will be Class C under Rule 3.